everybody. We're going to look at the order of the blood flow through the heart. I'm not going to spend a lot of time addressing cardiac anatomy in this particular lecture, so if you need to review that, please go back and review the parts of the heart. But let us take a look at how blood flows through the heart in what order. Okay, so this side right here is the right side of the heart. Remember, it's patient right. Okay, so it's the opposite of our right on the paper. This side is patient left. Okay, again, it's patient left. Okay, where that point is. All right, we've got two big veins that are ultimately going to be the last two veins that empty into the heart for all of the blood flow. All right, and that is the superior vena cava, which is up here, and the inferior vena cava down there. The superior vena cava will be the last large vein for anything above the diaphragm. All right, so think head, upper chest, arms. The inferior vena cava is the last vein for anything below the diaphragm. Okay, so abdomen, legs, does a lot of work. Despite the fact that they look like they're coming from two different locations, the superior and inferior vena cava are going to empty their blood into the right atrium. Okay, so as the blood comes back from that superior vena cava, that inferior vena cava, all right, I know it's tough to see, but all of the blood ends up from both of those into that right atrium. And at this point, remember, all of that blood has been around the body, so we consider it to be very low levels of oxygen. So as it's coming into the right side of the heart, it is often drawn as a little bit blue, lower oxygen levels. All right, its next job is going to be to go around the lungs and pick up some oxygen. All right, so the next step on this journey is to go from the right atrium, past this little valve that sticks down between the right atrium and the right ventricle, which is the tricuspid valve. So it goes from the right atrium, past the tricuspid valve, and into the right ventricle. Okay, so now we've got some blood past that right atrium, down into the right ventricle, and in order to get there, it had to pass that tricuspid valve. All right, remember the atrium are relatively small on both sides because their job is really just to pump the blood down into the corresponding ventricle, right? So the right atrium goes down to the right ventricle, the left atrium goes down to the left ventricle. All right, now that we've got this lower oxygen blood, all right, down into the right ventricle, we need to get this around the lungs. Okay, and we do that through our next series of arteries. And this next series of arteries looks like a little T. So it'll come up straight, and then it'll make kind of a T-bar shape. And one of those parts goes underneath this aorta right here. All right, this straighter part is called the pulmonary trunk, and then the pulmonary artery. So here's our left pulmonary artery, our right pulmonary artery. And if you remember, pulmonary was the word for lungs. All right, so those are going to circle around each lung, pick up oxygen, and then come back to the heart. So this is really where your blood's going to pick up its oxygen. In order to go out the pulmonary trunk in each corresponding pulmonary artery, it's got to pass a valve, okay, which I'm circling right here. And the valve that goes between the right ventricle and that pulmonary trunk is the pulmonary semilunar valve. Okay, so the blood goes from the right ventricle past that pulmonary semilunar valve, pulmonary trunk, to the pulmonary arteries. From here, it's going to circle out and around the lungs, pick up some oxygen. So now as it returns back to the heart, it's going to be much higher levels of oxygen than it was on that right side of the heart. So the right atrium, right ventricle had very low levels of oxygen. After it circles around the lungs and picks up oxygen, it is going to return via 4 sets of vessels. And you can see 2 over here, okay, on this right-hand side, and then 2 over here. You know, my arrow is a little bit in the middle of these. On the left-hand side, and despite the fact that there's 2 right pulmonary veins and 2 left pulmonary veins, all 4 of these are going to empty the blood into the left atrium. Okay, so again, even though it looks like two are on the right side, two are on the left side, they all end in the left atrium. So the blood returning back to the left side of the heart is full of oxygen. Okay. From those pulmonary veins, we are going to head right into that left atrium. All right, remember the atrium's job was just to get it down to the corresponding ventricle. So from this left atrium, blood is going to head into this left ventricle. And in order to get there, we have to pass a valve. Okay, and the one on the left side of the heart is the mitral or the bicuspid valve. Okay, so from the left atrium, we go past that mitral or bicuspid valve into the left ventricle. Next, blood is going to head out the aorta, which is the largest artery of the entire body. You can see its continuation after it goes behind the heart, goes all the way down the abdomen and into the pelvis. All right, so this will be the artery that sort of feeds all of other arteries. And in order to get the blood from the left ventricle out this aorta and then dropping off oxygen to the rest of the body, it needs to go past a valve, okay, right here at the tip of the arrow. And the name of the valve between the left ventricle and the start of the aorta is the aortic semilunar valve. Okay, so again, it goes from the left ventricle past the aortic semilunar valve out the aorta. Okay, so as we head out the aorta, we are then going to take it to everywhere else in the body, drop off good old oxygen, and then we are going to come back and repeat the cycle all over again, right? So once we've gone through the arteries and the capillaries, dropped off our oxygen and our nutrients, we are going to return back to the heart in order to pick up oxygen once again, and we return back to the heart by our last two veins, either the superior vena cava or the inferior vena cava, which both empty into that right atrium. Okay, so let's do this very quickly, okay, all together one time. So again, we are back at the superior and inferior vena cava, both of those empty, okay, into the right atrium. The right atrium is going to push blood past the tricuspid valve into the right ventricle. From the right ventricle, we are going to head past the pulmonary semilunar valve into the pulmonary trunk and the right and left pulmonary arteries. We are then going to circle the lungs, pick up oxygen, and return back to the heart via the 4 pulmonary veins. So there's 2 on the right, 2 on the left, and they all empty into the left atrium. From the left atrium, blood is going to head past the mitral or the bicuspid valve and into the left ventricle. From the left ventricle, we are going to head past the aortic valve, up and out the aorta, dropping off blood throughout the body, okay? And then it will return back to the beginning, okay? Superior, inferior vena cava, right atrium, right, rinse and repeat. So there's 2 things I want to talk about. The first is stenosis. And stenosis is a hardening of a valve. Okay, to stenose anything refers to it being hardened. And a hard valve does not allow blood to move properly. Right, if we look at all of the valves, and in particular, right, if we look at, let's look at the tricuspid and the bicuspid, okay, those point in one direction. And in fact, it is nice and open when blood wants to go from the right atrium to the right ventricle or the left atrium to the left ventricle. But if it were trying to go the opposite direction, okay, the shape of those valves would start to push closed and it would essentially form a wall if it tried to go in the improper direction. But stenosis is a hardening of a valve, and a hardened valve is not going to move nearly as much as it should. So what's going to happen with stenosis is that it's going to be very, very tough, okay, for blood to get pushed into the next area. Okay, so if it is a stenosed tricuspid valve, okay, it's going to be very hard for that right atrium to push blood into the left ventricle. If there's stenosis in that mitral valve, it is going to be very hard for that left atrium to push blood into the left ventricle. All right, because it is so difficult to push blood, okay, into the next location, blood is going to back up, okay, before the valve that is stenosed. All right, creating higher pressures, buildup, weakening potentially of muscle long term, and then lower pressures, right, in the chamber where the blood should be pushed. All right, on the other hand, we have what we call regurgitation. And this is when the valve's a little bit weak. Sometimes it's called leaky, right? Those are some other terms that are sort of used to describe those valves. And what that means is that it moves easily. So it allows blood to go in the direction that it wants. But if it's trying to go the opposite direction, it's also allowing some of that. Okay? So for example, if it's going from the right atrium down to the right ventricle, that won't be a problem because it's not hardened, it's not difficult to push past. But if the blood in the right ventricle tries to go backwards into the right atrium, okay, this tricuspid valve would not close entirely, allowing a little space open, okay, for that blood to actually flow back. So what you have ultimately, right, is again, too much blood in the original location, not enough in the area that it is supposed to be pushed into. Okay, so again, the difference between stenosis is that is a hardening, which is just difficult to push past, and a regurgitation, or that weakening, right, or leaking, allows blood to flow backwards in a direction that you don't desire. Okay, hopefully that was helpful to you. Please leave some comments below. Thank you.